traditional trauma therapy versus holistic trauma therapy. Is there any difference? Is one better than the other? Let's get into it today on the holistic therapy revolution. So, have you ever had a client say, I understand my trauma logically. I've discussed it for many years in therapy. I know my childhood affected me, but I still shut down in relationships. Or I've done trauma therapy and I'm still anxious. I'm still hypervigilant. I'm still emotionally overwhelmed. I'm still stuck. I still can't seem to be able to achieve the goals that I want. I still do not feel good enough about myself. I still pick the same kinds of partners. Or maybe you've experienced this yourself. Maybe you have done all the work, but you still find that you have not arrived where you want to be. And that's confusing because you understand what you've experienced, but it's not translating into the type of change that you would expect or that you desire. So honestly, this can be kind of confusing for people because if the person has done the therapy, they have the insight, yet their nervous system, their patterns, their body, their behaviors still are repeating the same things. What the heck is going on, right? So today we're talking about something really important. The difference between regular trauma therapy and holistic trauma therapy, or regular healing versus holistic healing, and more importantly, why healing the whole system often creates a more lasting change. Welcome back to the Holistic Therapy Revolution. I am Beth Miller. I have been a holistic therapist for over 25 years. I am the creator of the Advanced Holistic Counseling and Coaching Model. And this topic is dear to my heart, in part because I'm a trauma therapist, but I focused exclusively on treating trauma and sexual trauma for the first 10 years of my career. And I'm going to do a separate episode about healing sexual trauma, so look for that one to come. But I train therapists and healers and coaches and doctors in combining the best psychotherapeutic tools with the best holistic and alternative tools so that we can really achieve that whole body healing. And that is in my certification in advanced holistic counseling and coaching. You can check out the link below if you would like to learn more about that. So what is regular trauma healing? Let's first start there. Traditional trauma healing often includes specific approaches. Things like talk therapy, insight work, cognitive therapy, exposure therapy, and sometimes modalities like EMDR. So talk therapy, insight therapy, it's often exploring and identifying what has happened or what we've experienced, and sometimes even making the connection to the patterns that are now existing in a person's life. And then how do we talk about it in order to bring insight and shift now? It also involves exposing ourselves to some of the difficult emotions, and then sometimes with the help of the therapist, regulating through that. And sometimes traditional psychotherapy involves EMDR. Now, EMDR is, first of all, an incredible model that stands for eye movement desensitization and reprocessing. I was trained in EMDR 25 years ago, and even though EMDR wasn't that popular yet, it had already been empirically proven to be a very effective model for trauma, which is why I knew it and started using it back then. And I'm incredibly glad to see so many people using EMDR now because they're realizing how effective it is in treating clients with a variety of issues, but certainly with trauma. So let me be clear about all of these things. Insight, exposure, cognitive work. These are all very effective modalities that are critical and really helpful. They can be powerful and life-changing for the client. So, for example, a therapist might help a client to understand how childhood criticism led to their perfectionism now, how emotional neglect created anxious attachment now, how trauma that they experienced shaped negative beliefs like I'm not safe, I'm not lovable, I'm not good enough, I have to stay in control, okay? And that insight really matters. In EMDR, The therapist may help the client to reprocess a traumatic memory so that it no longer feels emotionally overwhelming or having the same charge that it used to. And very often, that EMDR work on things like a car accident, a childhood abuse memory, a medical trauma, or a panic attack experience can lead to, when we do EMDR, the client may say afterwards, I can think about it, but I no longer feel emotionally activated about it. And that is really wonderful trauma healing work that can happen from EMDR. But here's where many clients may still feel stuck despite that. Even after some good trauma therapy, many people might still experience these things. Nervous system dysregulation, emotional flooding, hypervigilance, self-sabotage, relationship patterns and repeating the same patterns, chronic anxiety, shutdown responses, people-pleasing, fear of abandonment, continued attachment issues, difficulty feeling safe in the body, not being able to achieve goals, not being able to shift behavioral patterns that are a problem. Now, why is this? Because trauma does not only affect thoughts and memories, it also affects the nervous system, the body, emotional reflexes, behavioral patterns, subconscious programming, self-identity and beliefs, and even spirituality and the meaning that we experience in the world. So now let's take a look at what holistic trauma therapy can add and see if it feels like it is something that is a benefit to add on top of the traditional therapy. So holistic trauma healing says, what if we healed all of the layers that have been affected by this experience or by trauma? Not just the story, not just the memory, not just the beliefs, but the whole human being. So there are many categories of healing modalities that might be included in holistic trauma therapy that may not always be included in just traditional trauma therapy. One of those categories is called trauma processing modalities. So that does include EMDR. It also includes IFS and EFT tapping. So with EMDR, for example, if a client was in a severe accident, even years later, they might panic while driving. They may grip the steering wheel tightly. They may avoid highways. They may feel unsafe in motion. EMDR may help to reprocess the accident memory so that the nervous system no longer reacts with the same level of fear. IFS stands for Internal Family Systems, or it's also called parts work sometimes. And an example of how IFS might be a part of the holistic trauma treatment toolkit is where a client might keep sabotaging their relationships. So IFS might reveal that one part of the client wants love and another part fears abandonment. And then another part may push people away for protection. So instead of judging this behavior, the therapist is going to use IFS to heal the wounded protective parts underneath it. EFT tapping is another holistic trauma modality where the client might say, I know I'm good enough logically, but I still feel inadequate. And the therapist might use EFT tapping while focusing on shame, fear, rejection memories, and body sensations that will help actually to regulate the nervous system and reprogram that belief so that it is no longer holding the client back. A second category of modalities that are likely to be a part of holistic trauma therapy is somatic and nervous system healing. So remember, trauma is not just remembered, it is physically experienced. Examples of somatic work might be the client might say, I feel anxious all the time. But when they're asked to scan their body, they notice tightness in their chest, clenching in their stomach, shallow breathing, frozen shoulders. And instead of not only talking about that anxiety, the therapist might use grounding, orienting, breathing exercises, shaking exercises, vagus nerve regulation, progressive muscle relaxation, etc., so that the client actually feels safe now. A third category of modalities that a holistic trauma therapist is likely to use is repatterning the mental layer. So, trauma creates distorted beliefs. It changes the way we think about ourselves, about relationships, and about the world. So, examples might be I'm unsafe, people can't be trusted, I'll always be abandoned, people owe me something, I have no power, love equals pain. If you love me, you will do X, Y, and Z. Holistic therapy will actively repattern those mental loops. And for example, let's say a woman experienced betrayal trauma. Now, every time her partner doesn't text back immediately, her brain might say, I'm being abandoned. Now, even though logically she knows that may not be true, the holistic work is going to help identify the distortion, calm the nervous system, create new neural associations, practice new responses repeatedly, and over time, that new neural programming is going to be automatically shifting so that it is not just associated with that same trigger from the past. Another category of modalities that's likely to be part of holistic trauma healing is behavioral and neural repatterning. So trauma creates sort of automated or automatic survival behaviors. Examples of this are people-pleasing, emotional avoidance, overworking, shutting down, hyper-independence, staying in toxic relationships. These behaviors are adaptations. So an example of this might be a client that grows up with explosive parents. As an adult, they might avoid conflict at all times and at all costs. They might apologize constantly, suppress their own needs, panic when somebody else is upset. And the therapist is going to help them to be able to practice new boundaries, tolerate discomfort safely, stay regulated during conflict, create new behavioral experiences, and help the client to be able to change their neural patterning as well as their behavioral strategies and their behavioral choices. The brain will finally learn conflict no longer equals danger. Another category that holistic trauma therapy may include would be teaching emotion regulation and coping skills. So trauma often disables emotional regulation. It activates and arouses the brain, and sometimes emotion regulation skills, there's just not enough of them that are already resourced in the client for them to be able to access them, use them, and practice them effectively. Sometimes they never had those emotion regulation skills installed at all. In other words, people didn't teach them. So if the person doesn't know those skills or is not actively using them, even though we might desensitize or neutralize some of the trauma, the person still needs all this emotion regulation skills in order to be able to cope and adapt with regular life and even cope and adapt with past memories. So holistic trauma healing is going to include things like emotion regulation skills. I was a DBT therapist for over 10 years. And so holistic trauma healing may include a lot of emotion regulation skills because they're so needed. Nervous system stabilization, self-soothing, containment, grounding, etc. So an example of this is that a client may become emotionally flooded anytime a lot of their emotions arise. They may become overwhelmed by them. So instead of diving deeper immediately into those memories, the therapist instead might help the client use container exercises, breathing skills, orienting, self-holding, mindfulness. There's just an absolute ton of emotional regulation skills that clients need imparted to them and taught to them that they never really had the opportunity to use prior. And lastly, a category of modalities that are likely to be part of holistic trauma therapy are spiritual and energetic healing. So this layer is often completely missing from traditional trauma work. Really, spirituality and energy work has really been amputated from traditional therapy. Unfortunately, we're working hard to bring it back. But trauma frequently impacts our sense of meaning, our identity, our purpose, our relationship with the world, our spirituality, our exploration of spirituality, our connection to self, our belief that we can create or manifest the life that we want. All of the above can be highly impacted by trauma. So, for example, a client might say, I don't feel connected to myself anymore, or I don't feel connected to others, or I don't care about others at all, or I don't feel like I'm in charge of how my own world works. Holistic trauma therapy may include meditation, visualization, mindfulness, energy healing, chakra balancing, reconnecting to intuition, reconnecting to a sense of hope or purpose, living a meaningful life, and also connecting to some sense of oneness or largeness that the client believes in or has the opportunity to explore in holistic trauma work. So for some people, their spirituality actually becomes a huge part of restoring their own wellness. Now, the biggest difference between traditional trauma therapy and holistic trauma therapy is that traditional trauma healing often focuses on processing the traumatic event, incredibly important. Holistic trauma healing focuses on healing the entire system that adapted around the trauma. And that's a lot. And that requires many other modalities to be at play for the holistic trauma therapist to help the holistic trauma client. Because trauma affects thoughts, emotions, the body, relationships, behaviors, nervous systems response, identity, subconscious beliefs, sometimes our sense of spirituality itself, what goals we can achieve, what we believe we can have in life. It really touches everything. So when we compare regular trauma healing to holistic trauma healing, it's really not about one replacing the other. It's about expanding the healing process and bringing in more layers of healing so that the client can have more of a whole being experience of feeling more healing and feeling more thriving. Holistic trauma therapy asks, what would it be like to heal the whole person? What does this whole person look like when they're thriving? What do we need to do to align all of the layers of their being, not just their symptoms and not just the identified targeted problematic memories? That's the shift. And that very well might be the future of trauma healing. And that is certainly what's at the heart of the holistic therapy revolution. So I'm Beth Miller. I cannot thank you enough for your curiosity in being here. I would like to ask you to comment and subscribe below if this information was useful to you. If you're a therapist, a coach, a healer, a doctor who wants to learn how to integrate the most powerful psychotherapeutic tools with the most effective holistic modalities in an ethical, structured, professional, and powerful healing framework, you can check out my certification in advanced holistic counseling and coaching below. And I look forward to seeing you in the next episode of the Holistic Therapy Revolution.